Thank you, Callia. Okay, so our final presentation today is from two of the local lads. We have Sam Gibbings and Dave Worthington. Thank you. Obviously, they both work in the Sexual Health and Bloodborne Virus Programme, and they are going to be talking about the 2015-2016 Needle and Syringe Programme update. So please welcome Sam and Dave.
All right. Thanks, Sue, for the introduction, and thanks everyone for hanging around for the last presentation today in this very cold room. Is it just me that's freezing? It's very, very cool today. But we'll try to be as short and sharp as possible and get everybody out on the road. Indeed, very good. Very good, Di. All right, there we go. A bit of comedy. All right. We'll liven up this presentation. So, as introduced, I'm Dave Worthington. I work with the Sexual Health and Bloodborne Virus Program alongside Sam Gibbings, who many of you may have met over the years through his work at WA AIDS Council, but now he's with us, so we're really lucky to have Sam on board. We work within the bloodborne virus team, so primarily a lot of our work is dedicated towards coordinating the statewide needle syringe program, of course as the primary public health initiative to prevent the transmission of bloodborne viruses through people who inject drugs. So we're going to go through some of the key findings from the 2015-2016 annual report. Much like some of the other presenters, there's lots of information to cover, so we've tried to pull out a few key areas so we're not waffling on for too long. So we're going to go over some of the key reasons why we report. Well, I should say why NSP coordinators are required to report. Plus also what we do with that information. There's one thing saying that people need to report what's happening throughout the year, but what are we actually doing that information to assist the sector? We'll talk about response rate and how that compares to previous years, some information on service provision, key areas of service provision we think in the way of materials or resources distributed, plus also referrals offered to clients. Talk about some issues, whether they're disposal issues or operational issues encountered throughout the year, but also talk about some of the positive aspects, the professional development and service enhancement activities that have been developed over the 2015-2016 period. So, as a bit of background, most of us in the room here would be aware about needle syringe programs, even at a basic level, but they are, as I mentioned before, a leading public health initiative to prevent transmission of bloodborne viruses, primarily hepatitis C, amongst people who inject drugs. So there's many different forms of NSPs that take shape in WA. The information that we're going to look at today refers to needle syringe programs that are primarily based at regional and remote sites, hospital-based sites, community health centres, some of the centres that are not provided external funding, such as the needle syringe exchange programs that report through service reporting. So this information is to do with the NSPs that, like I said, primarily focused in the region. So a lot of the regions that have joined us today would have needle syringe programs at their hospital sites or their population health building. So, of course, in Australia, there's a number of strategies for WA, national WA, a lot of strategies for Aboriginal sexual health and bloodborne virus initiatives, hepatitis B, hepatitis C and HIV strategy. At a WA scale, many of you were involved in developing the 2015 to 2018 sexual health and bloodborne virus suite of strategies, which we've mentioned up there. A lot of these strategies, in fact all of these strategies mentioned here, address NSP in certain ways, as far as that key public health initiative to prevent transmission of bloodborne viruses, amongst other activities and key areas as well. So on to the NSP annual report itself. The Poisons Regulations 1965 and also the Poisons Act of 1964 were the previous legislative frameworks, if you will, to support needle syringe programs and the way they're to be provided in Western Australia. Just earlier this year, in January 30, the Medicines and Poisons Act of 2014. It's a little bit confusing because it's different years here. So the Medicines and Poisons Act of 2014 and the regulations that speak to some parts of that Act, the Poisons Regulations of 2016, were enacted. So all needle syringe programs now follow that set of legislation. Part of the legislation says that all NSPs must have an appointed needle syringe program coordinator, must be appropriately trained, plus they also must report back annually on the services provided in that financial year. For the Sexual Health and Bloodborne Virus program, this is a great opportunity for us to help plan and manage what's going on in the state when it comes to needle syringe program provision, and also monitor what's going on at a statewide level. Take on some recommendations from what's happening out in the regions and needle syringe program sites, and try to build up for the upcoming years. Plus also for needle syringe program coordinators and the NSP themselves, it's just a good opportunity for any of those coordinators or workers to report back any issues, or, like I said before, positives, any service improvements that have been made during that year. The Sexual Health and Bloodborne Virus program, with that information that's gathered each year, provide a summary report. That summary report has just been released online, so was it last week? Week before?
End of May.
End of May. So it's available online now, and we can provide that link out to everyone, which is, we think, a good summary report that brings a lot of that data together. Alright, on to the response rate. So out of 104 NSP approvals, so that's 104 NSPs that have an approval with the WA Department of Health to run needle syringe program services, 8 services were exempted from reporting. These are the services, like I mentioned before, that receive external funding to provide needle syringe exchange programs for enhanced services that already provide regular reporting to the Department of Health. So to reduce the burden on reporting there, we remove those services from this requirement. The Sexual Health, Bloodborne Virus program sent out a pro forma report, which is a short survey, or a paper survey, but also a link to an online survey, which is exactly the same questions, of course, and a time frame to complete that within, I think it was around 4 weeks. We allowed a 2-week extension on that date, just to allow for some people that may have been on leave and some people that might not have been able to report during that period. We're pretty lenient here at the Sexual Health program. So out of that information, we received 82 submissions, which is an 88% response rate, which is really good. 2 of those NSPs reported nil activity, which means there were no needles and syringes distributed during that year, and they didn't engage in the NSP activities, even though they still had an approval, which is fine. We would encourage NSPs, even if they didn't have any activity, to still report to us at that period of time to say, we didn't distribute any needles and syringes. There may be a reason why. The information that we're going to go through and that Sam will highlight mainly is focused on the 80 completed reports. So 80 full reports from NSPs that provided needles and syringes throughout the 2015-2016 year. Very briefly, before I pass over to Sam, our response rate, taking out those 2 responses, was at 86%, which is still very high, consistent with the 2014-15 period, which is 86.3%, and higher than 2013-14. Really, it hovers around that mark, and even in previous years, the mark has always been above 75% as far as response rate is concerned, and in fact, I think it's consistently above 80%. As far as service provision is concerned, like I said, Sam will dive into some of this stuff in greater detail, but as far as information and resource distribution is concerned, this was marginally higher than the previous year, although lower percentage-wise than the year before that, as you can see, but we're still talking about relatively stable figures. Sam will talk about more about what information and what resources were distributed most throughout the previous year. As far as referrals concerned, referral rate, same sort of thing, really has hovered around the same mark. Most referrals are informal for needle syringe programs, where the NSP worker may provide the client with a phone number or contact details for a service, and then it's up to the client to contact that referral type. So I think that's it for me. I'll pass on to Sam. Sam's going to detail some more of this information in greater detail.
Thank you, Dave.
No problem, Sam.
So as you can see, majority of the information distributed by Niels Fringe coordinators were hepatitis C, hepatitis B, safer using information. So generally speaking, we're looking at bloodborne virus information and harm reduction resources. As for the referrals that were provided by Niels Fringe programs, the majority of them would be to treatment and rehabilitation centres. So we're looking at drug and alcohol counselling, treatment and rehabilitation options, mental health care services, which really reinforces the fact that Niels Fringe programs provide people with, I suppose, a gateway into treatment referrals into other treatments. As for the disposal issues reported, you can see it's remained relatively the same sort of percentage over the last 3 reporting periods. There was a bit of a drop, but really because the sample size is relatively low, it's not really going to make that much of a big difference. So it's pretty much everything's business as usual. Inappropriate disposal of equipment can contribute towards a stigma against people who inject drugs, so it's really important that Niels Fringe programs are quite active in their role in ensuring that equipment is disposed appropriately. So we do constantly work with a number of different programs to ensure that some of these issues are being tackled and met. We do have a local government disposal report that we're currently working on. Probably hopefully next couple of months we'll have it released. Now one of the questions was to see if there was what the availability of sharps disposal bins were. As you can see, a fair proportion of the Niels Fringe programs did not have a sharps disposal bin at the site. And of those who did have a disposal bin on the site, they were often located inside of the health facility. The majority of those were then also aware that of the location of the sharps disposal bin outside of the site. So ensuring that these safe disposal options are available will ensure that there's a minimal amount of stigma and discrimination against people who inject drugs. Moving on to operational issues, let's see, once again, there really hasn't been that much of a shift in the number of issues reported by Niels Fringe coordinators for the client, staff and in the coordination itself. There was a slight increase in clients and staff issues and a slight decrease in NSP coordination. But once again, sample size is relatively low, so it's really not that much different from previous years. Some of the issues that were reported by Niels Fringe coordinators about the clients were disruptive, rude behaviour, injecting drug use on site, issues with the Niels Fringe vending machines, so vandalism of the machine, or the clients may have been upset about the machine not working properly. Some clients were smoking on site and littering on the premise. So a variety of different issues, some of them more serious than others. As for issues with staff, some staff may have had a moral objection to the program or anxiety to distributing needles and syringes. Some staff felt that working on the program added to their workload, so a lot of them are working in regional areas, so they may have limited time in terms of what they can do around the program, so they felt that that was an issue. High staff turnover was also another issue, and staff were unaware of the services actually providing the syringe program was an issue as well. As for problems with the needle syringe program coordination, some of the coordinators found it difficult allocating time towards the NSP role. Again, high staff turnover, recent change in coordination, so they may have been very new to the role and weren't familiar with what entitles the role. Again, needle syringe vending machine broken down, and disruptions of the fit stick supply, which is the fits that we provide. Moving on to general service matters. So this is some of the, professional development that was done by the coordinators themselves, or any activities that they've done to enhance the service. You can see with the NSP coordinators, a majority of them did participate in some form of professional development. 64, which is slightly lower than the previous year, but once again, small sample size numbers, so there's going to be a small amount of fluctuation with each year, but generally speaking, it's relatively similar to previous years. Some of the activities that they participated in involved doing the NSP Info Pack, which is an information pack that essentially includes some of the guidelines, how to run a needle syringe program, an example of the annual report, a number of resources that they perhaps could provide out. The online needle syringe program training package, which essentially covers about 3 or 4 hours of content around how to interact with clients, the role of them as a needle syringe program coordinator, information around brief intervention, I think I've already mentioned that, and treatment options that are available. As for enhancing the NSP, a majority of them participated in either promoting the online package, which I just mentioned, or telling them, training up the staff through small sort of workshops. Now, moving on to probably one of the most important ones, but this is to see, I suppose, how satisfied the needle syringe program coordinators were with the program itself. As you can see, a majority of people were satisfied. We had a slight increase in the number of satisfied people compared to previous year to 51 from 50, but there has been a trend with a decreasing number of people who are very satisfied with the program.
Is that percentage or numbers?
These are numbers specifically. So percentage would be about 63% and 11% of people who are very satisfied. But we haven't had anyone who was dissatisfied with the program itself. Some of the, I suppose, concerns that were raised in answering this was the delivery of the fit packs through the vending machines. So some of the coordinators were concerned that by only having a vending machine, they weren't engaging in the clients in brief interventions. So there was a missed opportunity there to provide them with referrals or information. And we had a coordinator who complained about, I suppose, their preference to actually have a vending machine and not engage in any sort of interactions whatsoever. And finally, just some of the needle and syringe distribution that we had over the year. You can see that we've finally broken the 6 million mark. Generally speaking, it's about a 10 to 13% increase for each preceding year. It's good to note that we've actually had a very large increase over the years for the regional areas, so some of the needle syringe programs out in the regions here. And in the last year, we saw an 18% increase, which is quite good. And that tells us that there's more equipment getting distributed in the regions as well. And as usual, it's usually the needle syringe exchange programs that make up the bulk of the distribution at about 60%. So these are WASWA, the Midwest, the WA's Council. And there's a couple of others as well. And I think that's about it. Anyone have any questions regarding this graph itself?
Not a graph, but when you talk about group numbers being very small, what numbers are we looking at in two? Well, one was the coordinators themselves, and that's a 50, isn't it? You've had a sample size of 50 people?
No, we had a sample, 80 reports were submitted. So 51 of those 80, which is about 63%, reported that they were satisfied with the program.
I think some of the small sample sizes really refer to some of the issues encountered, where there may have been 10 coordinators out of 80 that said there were some issues, and then those issues vary in, say, somebody smoking on site to aggressive behaviour.
Yeah. And it may have only been 1 or 2 out of the 80 reported, so, and the reporting period is an entire year, so it may have been only 1 or 2 instances in that entire year in a single location out of the 104 or so approvals that we've had, so really, but we still have to report on that. Any other questions? Yeah.
I'm not sure if I'm right, but a couple of years ago when I did the NSP coordinators training, there were, I think there was 128 needle and syringe programs in the state. Do we think there's any reason why there's been a reduction there?
So we have 104 approvals, which means, I suppose, certain organisations can have a single approval attached to them, but they may have several sites associated with that. And there are also a number of other needle syringe programs which may, I suppose, come under one approval, which covers a region as well. So chances are there are still quite a few sites out there, and if we're including pharmacies as well, it's actually well over 600.
Yeah, no, I was just thinking of the NSPs outside of the pharmacies.
Yeah, so I think Kalgoorlie, no, sorry, not Kalgoorlie, the Kimberleys would have about 8 or 9 approvals.
Yeah. It's definitely a lot of the regional areas where they might be a very small nursing post or a regional hospital that doesn't see many clients through, or doesn't have indeed many staff that work there. A major hospital may have an NSP approval, and that covers the coordination of 3 or 4 different sites within that local sort of area. So that would cover more up to the numbers of about 130, I guess, through these types of sites.
Okay, so that still would be about right then.
Yeah.
Cool. Thanks.
Just one quick one. If you go just to the previous slides when we're talking about disposal, and that's been a question that's been raised by our population, which is primarily the cold population. So when you talk about locations outside disposal bins, if disposal bins are not available, what are we looking at? Where does one find the disposal bins?
There is a website called safeshafts.org which does, I suppose, include a list of locations throughout WA that you can find disposal.
And if there are no locations, what would be, so there,
If you're talking, I'll just jump in, if you're talking about outside the health facility, so not within hospital,
yes.
Quite often it will be in a local park or a community, centre where it's usually within the toilet block, toilet complex, I guess. But there also are some areas that have disposal units that are out in the open. They might be on the side of the building or something like that as well. So there's a few different types of units that are available. And quite often it'll be local councils will be involved in putting those units in place.
Right, thank you. Did anyone in the region have a question for Sam or Dave? No?
And we will be sending out a copy of the report to anyone who requested as well after this.
Well, thank you very much, Sam. Thank you very much.